Are you ready? Let's go. Let's talk about a few tips to keep in mind when we're answering a Cloze question. Number 1, be sure to review all of the answer choices in the drop-down menu before making any selections. Number 2, if a question, like in our example, has 2 fill-in-the-blanks, it's important to consider the answer choices together because oftentimes they're linked or dependent on one another. Let's go read the question. The nurse performs a focused assessment based on the data available. The nurse assesses the client's blank based on the parent's report of blank. So we know now that we need to look for the available data. Let's check out the progress notes. At 9:15 a.m., we're seeing a 12-year-old girl with new onset unsteadiness, emesis not associated with meals, and a severe headache as of this morning. She has dehydration with mild renal impairment and has already been treated with IV fluids. However, she continues to be lethargic. She also has MRI results pending. Okay, now we've got to use our critical thinking skills to determine what's important and what stands out. Unsteadiness, vomiting, headache, and lethargy are all associated with a brain disorder or injury. So I'm thinking something neurologic is probably going on here. Let's go back to our question and review the answer choices. The options for the first blank about the focused assessment are eye movements, heart rhythm, and vowel sounds. But before we make a selection here, let's also review the answer choices for the second blank. Here, we can choose one of 3 reported issues: headache, vomiting, or unsteadiness. And since I'm most concerned about a neurologic condition, let's select headache. Now we can better understand what we should pick from the first drop-down. So let's go back and finish this question. Again, since we're most concerned about the parent's report of a headache, we now know we should assess the patient's eye movements as part of a focused neurological exam. Thanks for watching this video, and don't forget to click the thumbs